Hi, my name is Rin. I'm one of the assistants here at Union Avenue. I am going to show you how to administer sub-Q fluids to one of our patients. She's a little kitty cat. A lot of the times we'll send home sub-Q fluids to give at home for our chronic kidney disease or renal dysfunction cats to help keep them hydrated while they're at home. So I'm just gonna show you what our fluid bags look like real quick. When you get one sent home, it will have a little prescription label on it that tells you how often and how many fluids to give. And then on the front of the bag, you'll see these numbers. If a full bag that hasn't been used at all will be, the water line will be above the 1. So when you hit the 1, that means you've emptied out 100 mils. If you hit the 2, you've emptied out 200 mils. So it looks like we've used almost 300 mils out of this bag so far. And then your bag will have a fluid line attached to it, and you'll notice that there are a couple of different clamps on it. This is used to close off the line so that it's not just constantly leaking out. You do want to keep it clamped when you're not administering the fluids. So one way to do that, I think this is the easiest way, is to roll this roller all the way down. That's clamped. If you roll it up, it's unclamped. And then at the end, you'll have a needle. So one of the important things about sub-Q fluids is that we want to keep this area sterile. So if you take the needle off, you just have this port, and you never want to leave this open to the elements or, throw it in your bag with this open. But you can just leave your needle on it, and that will keep it sterile. Leave the cap on the needle, that way everyone's safe. And then just make sure that you place a new needle on when you are going to give your sub-Q fluids. And according to her prescription label for her fluids, she gets 100 mils under the skin on Tuesdays and Fridays, so twice a week. So Mocha is pretty good about sitting here for us while we do these fluids. She's been doing this for a really long time, so she is very used to it, and she's become kind of accustomed to it. So she's a perfect patient for this example. So these sub-Q fluids, basically we are placing a good amount of fluids under the skin right here, where their scruff has some loose skin, and there's kind of a pocket under there where we can administer those fluids. And then her body will absorb the fluids over the next 24 to 48 hours. It'll help keep her hydrated. So I'm gonna go ahead and show you how we do that with Mocha. So when you're doing this at home, you're probably you might want to have an extra set of hands, but you might be by yourself. So I'm going to show you how I might do it if I was by myself. And one of those things, maybe I need someone to put a hand on her while I grab it. Something that can help you out is using a clip to hang the bag up. And you want to hang the bag somewhere about 2 feet above the patient, but it doesn't have to be exact, just above the level of the patient so that gravity helps the fluids flow. So you can use a carabiner clip or some other type of hook to hang up your fluids. And here I'm just using a little cabinet door handle. And then you just want to make sure that your line will reach your pet. And then I have placed a brand new needle on this line. So that's something you'll want to do every time that you're about to do your fluids, is make sure that you place a brand new needle on here. And while you're doing that, you want to make sure not to touch the tip of this to anything and not to touch the open part of your needle hub, and just to connect them to each other. And then you'll kind of feel the skin. We call this, you'll tent the skin, and then you'll see here that if you hold it up, you can use if you hold it with your middle finger and your thumb, you can use your pointer finger to feel right here. That's kind of a sweet spot, and a little triangle forms there. And that's where you're gonna wanna poke with your needle so that you're going into that space under the skin. So you're not poking, you don't want your needle to stay in the skin layer. You want it to actually go under the skin layer, but you don't want to poke down into the fat or muscle or anything like that. So you'll take your cap off of your needle, and needles have what we call a bevel. So that's that cut edge where you can see the opening of the needle. That you want to be facing up. And then you'll tent up your skin and you will find that little sweet spot triangle, and then you will poke with your needle parallel to the patient into that sub-Q space, which is the space under the skin. So now that I have poked the needle into that sub-Q space, I'm just going to hold the line a little farther down so that I'm not holding right where the needle is, but that I'm still stabilizing that. And then I'm going to unclamp the line here, and you'll notice that our fluids start dripping. Sometimes after you've clamped the line, it'll still be a little compressed there, so you have to kind of massage that to loosen it up to allow the fluids to flow. And then you can watch here that our fluids are flowing, and it's okay if you want to just leave your bag hung up and let gravity do the work. If you have an extra set of hands and are able, you can gently squeeze the bag to speed up the process a little bit, making sure that your pet is comfortable. You'll be able to feel already that there is some fluid building up under the skin. That's perfect. And when we're done with it, she'll have what we like to call a little camel hump. So you'll be able to actually feel and see that pocket of fluids there, and that'll go down over the next 24 hours. So here I'm just gently squeezing the bag. That just helps our fluids flow a little faster, especially if you have a large quantity of fluids that you're doing. This will help speed up the process so our pet doesn't have to sit still for too long. We're getting close, but I still have a little ways to go to be just above that 4. Okay, so now we're just above that 4 line, so I'm gonna go ahead and roll down our clamp. You'll notice that the fluids stop dripping, and then I can put my bag down. And then to remove the needle here, I like to pinch around where that needle is and then pull out the needle and keep holding pressure on that skin. You can either hold pressure just by pushing your fingers down, or you can gently pinch that area. Okay, so now I'm going to use this paper towel, pretend that this is skin, that little area, the scruff area of the cat, just to show you what to do, some troubleshooting that you can use if you're having trouble after you've poked. So sometimes what happens is you'll poke your needle in and you'll unclamp your fluids and then it's flowing that way. And sometimes that is because your needle is poked all the way back through out of the skin. So something you can do if this happens is just pull your needle back a little bit and watch and see if the fluids start building up under the skin. Then you can keep going with your administration, and there's no need to re-poke as long as you can just retract that needle and keep it under the skin. Sometimes you'll have a little leaking from that hole that you've just made, but that's okay. And then if you just don't feel good about your poke or it's not flowing, you can move your needle around ever so slightly. You do want to keep it parallel with the pet's body and with their skin, but move it around and watch to see if your fluids start flowing, if they start dripping. If it doesn't work, just gently moving it around, you can just take your needle out, recap it, and then you can put a new needle back on to your line and just retry. Start over again. Sometimes you just need a second poke. But if you have poked again, you might have some leakage from that hole that you already made, and that's okay, as long as you can see that the fluids are still building up under the skin. And after you've removed your needle and you've held pressure on that area, sometimes you will still notice a little bit of fluid leaking out. That's okay, that's normal. Sometimes it'll be a little bit pink tinged because you might have poked a little skin capillary. That's no big deal. As long as you can still see that the fluids are still under that skin, a little bit of leakage is okay. And it'll stop after a few minutes. The fluids also can tend to migrate a little bit, especially if your pet has a good amount of loose skin up there. Sometimes it'll look like they've flopped over to one side. Sometimes you'll even see some swelling in their armpit or their elbow because it's just flopped over to that side of the body. That goes down after about 24 hours. If you are concerned about that, or if you're seeing some swelling that's lasting longer than that, just give us a phone call and we'll let you know what to do about that and where to go from there. And then when you're done with your needle, you want to recap it and then dispose of it properly. In Tacoma and Pierce and King County, you can actually dispose of your needles inside of a strong plastic container. So something like a bleach container or an old detergent bottle. You can put your needles in there, close it, wrap it with duct tape, and then write on it that do not recycle. And you can just dispose of that in your normal trash. And then I also wanted to touch on some fun things like treats and different ways to help your pet with the experience of sub-Q fluids. Sometimes it goes really smoothly. Sometimes they just don't like to sit still for a long amount of time. Usually they don't really react to the poking of the needle. But if you're noticing some of that, you can use some distractions. So we like to use Churu treats for our kitties here, and you can use your dog's favorite treats, any sort of high value treat, as long as it doesn't disrupt their digestive system and you know that they're used to it. You can get crafty with some distractions. I know my dogs love lick mats, so you can get those silicone lick mats and spread peanut butter or wet food on there, and then you can stick that somewhere. Some of them even have suction cups. You can stick it on a wall, and that acts as like your extra set of hands that's just feeding your pet treats so that you have both of your hands free to do those fluids. And then sometimes it is also helpful to have a second person holding your pet. Some pets are much more comfortable in someone's arms. So say you have a cat that just doesn't sit still on the table, you can just have someone hold your cat. As long as that upper shoulder area is accessible, then you can still administer those fluids while your pet's being held, as long as you and the person holding feel safe. Some cats also do really well. They really love their carriers, and that's like a safe space for them. So if they're really comfortable in their carrier, you can toss some treats in there, maybe some catnip, let them get comfortable in there, and then just open it up and take a peek at them, and you can actually give their fluids while they're in the carrier. We have some cats that come in here that are much more comfortable that way than going through taking them out and messing with them. So we just keep them in their carrier, administer their fluids, hold them off, and then they're ready to go. If you have any questions about anything in this video, you can give us a phone call and we'll help you walk you through it.